Welcome back. New York State has unveiled the results of its first ever first responder mental health needs assessment. Called HOTLINK, the state is hoping the findings will help provide adequate resources to the many first responders who keep us safe.
WENY's Connor Freithoff spoke with first responders to understand the scope of the survey and how the data from it can help those who ultimately help us. Connor?
Nick, Renata, the Division of Homeland Security and Emergency Services and SUNY New Paltz organized a survey for over 6,000 participating first responders who gave feedback on how mental health has a significant impact on their lives at and outside of their work. Answering the call can take a toll. Frontline personnel such as law enforcement, firefighters, 911 dispatchers, and emergency service workers all deal with disturbing and unsettling situations at work. The state is taking steps to support and protect the thousands of first responders, including tackling stigma.
There is a stigma in first response that if you seek mental health, you're considered weak and that you're not going to be strong enough to do your job. First responders are really good at taking care of others. They're not very good at taking care of themselves.
More than half of the respondents said that they've experienced symptoms of anxiety and depression on the job. 59% said that they've experienced burnout. Steps are being taken at the local level to allow law enforcement to process what they've seen and experienced on the job.
We've institutionalized more debriefings for traumatic events, just so the rank and file here get their time to just talk about what they saw, how they're feeling. It's very important.
Sometimes it's the length of time spent in this environment that causes so much stress. It can cause first responders to bottle it up over time.
And what we see a lot with first responders is that certain things will trigger them, and they don't even know that that's a problem until it's just that accumulated stress comes to a breaking point.
Measures to improve and expand access to mental health resources are part of several initiatives in the most recent State of the State. DHSES and SUNY New Paltz will present their findings to the New York State Emergency Management Association Annual Conference in Syracuse next Wednesday. Nick, Renata?